As midnight approaches, Arjun settles into his desk, determined to finish his studies. His mind is sharp, but his body quickly signals the need for more energy to keep going. In these moments, the demand for fuel becomes urgent, setting off a remarkable process within his cells. This is where the journey of glucose metabolism begins, powering Arjun's focus and endurance through the night. Glucose, a primary energy source for cells, enters through specialized transport proteins in the cell membrane. Once inside, glucose undergoes a series of enzymatic reactions known as glycolysis, which breaks it down to produce energy in the form of ATP. A key control point in this pathway is the enzyme phosphofructokinase 1, or PFK1. This enzyme acts as the rate-limiting step, tightly regulating the pace of glycolysis according to the cell's energy needs. By controlling PFK1 activity, the cell ensures efficient use of glucose and maintains metabolic balance. When oxygen levels in the body are low, cells must find an alternative way to produce energy. In this situation, pyruvate, a product of glucose breakdown, is converted into lactate instead of entering the usual oxygen-dependent pathways. This process allows energy production to continue, but it also leads to the accumulation of lactic acid in the body, a condition known as lactic acidosis. Lactic acidosis can occur during intense exercise or in medical emergencies like shock, when tissues are deprived of adequate oxygen. When oxygen is present, pyruvate produced from glycolysis enters the mitochondria, where it encounters the pyruvate dehydrogenase complex. This multi-enzyme system catalyzes the conversion of pyruvate into acetyl-CoA, a crucial step that links glycolysis to the citric acid cycle. Acetyl-CoA then enters the citric acid cycle, enabling the cell to extract a significant amount of energy through aerobic respiration. The efficient functioning of the pyruvate dehydrogenase complex is essential for maximizing ATP production, supporting the energy needs of the cell. When the pyruvate dehydrogenase complex fails to function properly, pyruvate cannot be efficiently converted into acetyl-CoA. As a result, pyruvate begins to accumulate within the cell. This excess pyruvate is then redirected into alternative metabolic pathways, most notably being converted into lactate. The increased formation of lactate can lead to lactic acidosis, a condition where the blood becomes too acidic. Such metabolic disturbances can have serious effects on cellular function and overall health. Within the mitochondria, the TCA cycle, also known as the Krebs cycle, plays a central role in cellular respiration. It systematically breaks down acetyl-CoA, releasing electrons that are carried to the electron transport chain. This chain, composed of a series of protein complexes, uses these electrons to create a proton gradient across the inner mitochondrial membrane. The energy stored in this gradient is then harnessed to produce large amounts of ATP, the primary energy currency of the cell. Together, the TCA cycle and electron transport chain are essential for meeting the high energy demands of living organisms. Certain toxins, such as cyanide, have a profound impact on cellular respiration by targeting the electron transport chain. Cyanide binds to a key enzyme called cytochrome C oxidase, effectively blocking the final step where electrons are transferred to oxygen. As a result, cells are unable to produce ATP, the essential energy currency, despite having adequate oxygen available. This disruption leads to rapid cellular energy failure, which can be fatal if not addressed promptly. The ability of toxins to halt energy production highlights the critical role of the electron transport chain in sustaining life. Now let's shift our focus to metabolic storage diseases. These conditions occur when the body is unable to properly process or store energy reserves, such as fats, carbohydrates, or proteins. As a result, harmful substances can accumulate in cells, leading to a range of health issues. The inability to manage these energy stores disrupts normal cellular function and can affect multiple organs. Understanding these diseases is crucial for recognizing how vital proper energy regulation is to overall health. Von Gierke disease is a rare genetic disorder that disrupts the body's ability to release glucose from the liver. This impairment results in dangerously low blood sugar levels, a condition known as severe hypoglycemia. Additionally, the buildup of certain metabolic byproducts leads to lactic acidosis, which can further complicate the disease. These metabolic disturbances often present early in life and require careful management to prevent serious health consequences. Pompe disease is a rare genetic disorder that affects how the body processes glycogen, a stored form of sugar. In this condition, a deficiency of a specific enzyme leads to the accumulation of glycogen within muscle and heart tissues. Over time, this buildup disrupts normal muscle function and can significantly enlarge the heart, a condition known as cardiomegaly. The effects of Pompe disease can vary, but the involvement of both skeletal and cardiac muscles often leads to serious health complications. McArdle disease is a rare genetic disorder that affects how muscles use glycogen, the stored form of sugar in the body. In this condition, muscles are unable to break down glycogen efficiently, which means they cannot access a vital energy source during physical activity. As a result, individuals with McArdle disease often experience muscle cramps and fatigue shortly after beginning exercise. These symptoms can limit physical performance and may sometimes be accompanied by muscle pain or weakness. Understanding this disease is important for managing activity levels and preventing complications. Metabolic diseases encompass a range of disorders that disrupt normal biochemical processes in the body. These disruptions often lead to distinctive clinical symptoms, such as hypoglycemia, muscle weakness, or developmental delays, depending on the specific metabolic pathway affected. Understanding the connection between these diseases and their symptoms is crucial for accurate diagnosis and effective treatment. In medical education, recognizing these patterns is emphasized, as they frequently appear in clinical practice and are commonly tested in examinations. Mastery of this knowledge equips future healthcare professionals to better identify and manage metabolic disorders. The intricate relationship between biochemistry and the nervous system plays a crucial role in shaping our thoughts, feelings, and actions. Central to this connection are neurotransmitters, the chemical messengers that transmit signals between nerve cells. These molecules influence a wide range of functions, from regulating our mood to controlling movement. Changes in neurotransmitter levels can lead to noticeable effects, such as shifts in emotional state or alterations in motor skills. Understanding how these chemicals operate helps us appreciate the complex ways our bodies and minds are interconnected. Dopamine is a crucial neurotransmitter synthesized in the brain from the amino acid tyrosine. The process begins when tyrosine is converted into L-dopa, which is then transformed into dopamine. Dopamine plays a significant role in regulating motivation, reward, and movement. In Parkinson's disease, the brain's ability to produce dopamine is diminished, leading to symptoms such as tremors, stiffness, and difficulty with movement. This reduction in dopamine not only affects motor control, but can also impact motivation and mood. Huntington disease is a genetic disorder that affects the brain, leading to progressive movement, cognitive, and psychiatric symptoms. One of the key features of this condition is an excess of dopamine activity in certain areas of the brain. This imbalance disrupts normal motor control, resulting in involuntary jerky movements known as chorea. Over time, these symptoms can worsen, significantly impacting a person's ability to perform daily activities. Understanding the role of dopamine in Huntington disease helps explain why movement becomes so difficult to regulate. Serotonin is a neurotransmitter that plays a crucial role in regulating mood, sleep, and appetite. Its synthesis begins with the amino acid tryptophan, which is converted through a series of biochemical steps into serotonin within the brain. Low levels of serotonin have been linked to mood disorders such as depression. Selective serotonin reuptake inhibitors, or SSRIs, are a common class of antidepressant medications that work by increasing the availability of serotonin in the brain. By enhancing serotonin signaling, SSRIs can help alleviate symptoms of depression and improve overall emotional well-being.
Arjun's fascination with genetics began at an early age, driven by a deep curiosity about how certain diseases seem to run in families. He often wondered why some traits and conditions were passed down from one generation to the next, while others appeared randomly. This intrigue led him to explore the principles of inheritance and the science behind genetic patterns. As he delved deeper, Arjun realized that understanding these mechanisms could unlock answers to many medical mysteries. His journey into genetics was fueled by a desire to uncover how the blueprint of life shapes our health and future. Autosomal dominant inheritance refers to a genetic pattern where just one altered copy of a gene is sufficient to cause a particular disease. This means that if a parent carries the mutated gene, there is a 50% chance of passing it on to each child. Marfan syndrome is a classic example of this inheritance pattern. Individuals with Marfan syndrome often exhibit features such as tall stature, long limbs, and heart complications, all resulting from a single copy of the affected gene. Understanding this pattern helps in predicting the likelihood of a condition appearing in families. Autosomal recessive inheritance occurs when a condition is caused by mutations in both copies of a particular gene. Individuals must inherit one mutated gene from each parent to develop the disorder. This pattern often means that the condition appears among siblings, while parents typically do not show symptoms. Cystic fibrosis is a well-known example, where both parents are usually carriers but unaffected, and their children have a chance of inheriting the disease if both gene copies are mutated. Understanding this inheritance pattern helps explain why certain genetic disorders may skip generations yet affect multiple siblings. X-linked diseases are genetic disorders caused by mutations on the X chromosome. These conditions tend to affect males more frequently because males have only one X chromosome, inherited from their mother. If a male inherits a faulty gene on the X chromosome, he lacks a second healthy copy to compensate. In contrast, females have two X chromosomes, so a normal gene on one can often mask the effects of a defective gene on the other. This difference in genetic makeup explains why X-linked diseases, such as hemophilia and Duchenne muscular dystrophy, are more prevalent in males. Chromosomal disorders occur when there are abnormalities in the number or structure of chromosomes. One of the most well-known examples is trisomy 21, commonly referred to as Down syndrome. Individuals with Down syndrome typically have an extra copy of chromosome 21, which leads to a range of physical and developmental characteristics. Intellectual disability is a common feature, often varying from mild to moderate in severity. Additionally, many individuals with Down syndrome are born with congenital heart defects, which may require medical intervention early in life. Anticipation in genetics refers to a phenomenon where certain inherited disorders become more severe or appear at an earlier age as they pass from one generation to the next. Huntington disease is a well-known example of this pattern. In families affected by Huntington disease, children often experience symptoms earlier and with greater intensity than their parents. This progressive worsening is linked to changes in the genetic material, specifically the expansion of repeated DNA sequences. Understanding anticipation helps explain why some genetic conditions seem to accelerate across generations. Arjun's journey now leads him into the fascinating realm of microbiology. Here, he delves into the study of organisms too small to be seen with the naked eye. As he explores this invisible world, Arjun learns about the diverse pathogens that can cause disease. This new focus challenges him to understand how these microscopic entities interact with the human body. Through careful observation and research, Arjun uncovers the crucial role microbes play in both health and illness. Gram-positive and gram-negative bacteria are distinguished by differences in their cell wall structure, which can be identified using a laboratory staining technique called the Gram stain. Gram-positive bacteria have a thick peptidoglycan layer, causing them to retain the violet stain, while gram-negative bacteria possess a thinner layer, and an additional outer membrane, resulting in a pink appearance after staining. This classification is essential because it influences how bacteria respond to antibiotics. Certain drugs are effective against one group, but not the other. Understanding whether an infection is caused by gram-positive or gram-negative bacteria helps clinicians select the most appropriate and effective treatment. This distinction ultimately improves patient outcomes and helps prevent antibiotic resistance. Streptococcus pneumoniae is a leading cause of community-acquired pneumonia, often presenting with symptoms such as cough, fever, and chest pain. This bacterium is especially common in young children, the elderly, and individuals with weakened immune systems. In contrast, Staphylococcus aureus is frequently associated with skin and soft tissue infections, including abscesses, cellulitis, and impetigo. These infections can range from mild to severe, sometimes requiring medical intervention to prevent complications. Recognizing the typical pathogens involved helps guide appropriate diagnosis and treatment in clinical practice. Pseudomonas aeruginosa is a bacterium known for its ability to cause serious infections, particularly in individuals with compromised skin barriers, such as burn patients. Its resilience and adaptability make it a common culprit in burn wound infections, where it can delay healing and increase the risk of complications. One of its most distinctive features is the production of a blue-green pigment called pyocyanin, which not only gives infected tissues a characteristic coloration, but also contributes to the bacterium's virulence. This pigment can interfere with cellular functions and promote tissue damage, further complicating recovery. Understanding these traits is crucial for effective management and prevention of Pseudomonas infections in vulnerable patients. Bacterial toxins are potent substances produced by certain bacteria that can cause severe effects in humans. Clostridium tetani, for example, releases a toxin that interferes with nerve signaling, resulting in painful muscle spasms and stiffness. In contrast, Clostridium botulinum produces a toxin that blocks nerve impulses to muscles, leading to paralysis. These toxins highlight the diverse and dangerous ways bacteria can impact the body. Understanding their mechanisms is crucial for developing effective treatments and preventive measures. Virology is the study of viruses, microscopic agents that can infect living organisms. Unlike bacteria, viruses are not cells and cannot reproduce on their own. They require a host cell to multiply. This fundamental difference affects how they behave and how infections are treated. While bacterial infections can often be cured with antibiotics, viruses do not respond to these medications. Instead, antiviral drugs or vaccines are used to prevent or manage viral diseases. DNA viruses, such as herpes, possess the unique ability to enter a latent state within host cells. This means they can remain dormant for extended periods, often reactivating under certain conditions. In contrast, RNA viruses like influenza are characterized by their rapid mutation rates. These frequent genetic changes enable them to evade immune responses, making them challenging to control and contributing to seasonal outbreaks. The fundamental differences in their genetic material underpin these distinct behaviors and impacts on human health. Parvovirus B19 is best known for causing the characteristic slapped cheek rash seen in children, medically referred to as erythema infectiosum. This viral infection typically presents with bright red cheeks and a lacy rash on the body. Beyond its skin manifestations, parvovirus B19 can have serious hematological effects, particularly in individuals with underlying blood disorders. In patients with conditions such as sickle cell disease or hereditary spherocytosis, the virus may trigger an aplastic crisis, leading to a sudden drop in red blood cell production. Recognizing these complications is crucial for timely diagnosis and management. HIV, or human immunodeficiency virus, primarily targets the immune system by attacking CD4 T cells, which play a crucial role in coordinating the body's defense against infections. Once inside the body, the virus binds to these cells and uses their machinery to replicate, gradually reducing their numbers over time. As CD4 T cell levels decline, the immune system becomes increasingly compromised, making it difficult to fight off common infections and diseases. This progressive weakening of immune defenses is what leads to immunodeficiency, leaving individuals vulnerable to a range of opportunistic infections and certain cancers. Pharmacology is the study of how drugs interact with the body and influence biological processes. As Arjun begins his journey into this subject, he quickly realizes that understanding drug side effects is crucial, especially when preparing for exams. Side effects can range from mild to severe, and knowing them helps in both clinical practice and academic assessments. Recognizing these effects not only aids in patient safety, but also ensures Arjun is well prepared for exam questions that often focus on this topic. Several commonly used medications are associated with distinct side effects. Beta blockers are known to slow the heart rate, which can be beneficial in certain conditions, but may lead to bradycardia. ACE inhibitors often cause a persistent cough in some patients, making them less tolerable for those affected. Aminoglycosides, a class of antibiotics, carry a risk of kidney damage, requiring careful monitoring of renal function. Macrolides, another group of antibiotics, can prolong the QT interval, increasing the risk of cardiac arrhythmias. In mastering medical concepts, understanding the underlying mechanisms offers a deeper and more lasting grasp than simple rote memorization. When you comprehend how and why processes occur, you can apply your knowledge to new and complex situations with greater confidence. This approach not only enhances critical thinking, but also fosters adaptability in clinical practice. Ultimately, prioritizing mechanisms builds a strong foundation for lifelong learning and effective patient care.
Arjun embarks on a comprehensive journey through the fields of cardiology, renal physiology, and immunology. Along the way, he delves into essential clinical concepts, building a strong foundation for understanding complex medical conditions. By focusing on high-yield facts, Arjun ensures that his learning is both efficient and impactful. This exploration not only deepens his knowledge, but also prepares him for real-world clinical scenarios. The heart is a muscular organ divided into 4 chambers, 2 upper atria and 2 lower ventricles. Blood enters the right atrium from the body, flows into the right ventricle, and is then pumped to the lungs for oxygenation. Oxygen-rich blood returns to the left atrium, moves into the left ventricle, and is then circulated throughout the body. This continuous pathway ensures that tissues receive the oxygen and nutrients they need. Understanding this structure and flow is essential for recognizing how various cardiac diseases can disrupt normal heart function. Aortic stenosis is a condition where the aortic valve, which controls blood flow from the heart to the rest of the body, becomes narrowed. This narrowing makes it harder for the heart to pump blood efficiently, putting extra strain on the heart muscle. As a result, people with aortic stenosis often experience classic symptoms such as chest pain, fainting spells, and shortness of breath. These symptoms occur because the body and brain may not receive enough oxygen-rich blood, especially during physical activity. Over time, untreated aortic stenosis can lead to serious complications, making early recognition and management essential. Mitral regurgitation occurs when the mitral valve fails to close properly, allowing blood to flow backward from the left ventricle into the left atrium during contraction. This abnormal movement of blood creates turbulence within the heart, which is heard as a distinct murmur through a stethoscope. The murmur associated with mitral regurgitation is typically described as a blowing or whooshing sound, most prominent at the apex of the heart. Over time, this backward flow can lead to increased pressure in the left atrium and lungs, potentially causing symptoms such as shortness of breath or fatigue. A myocardial infarction, commonly known as a heart attack, occurs when blood flow to a part of the heart muscle is blocked by a clot in the coronary arteries. This blockage deprives the heart tissue of oxygen, leading to damage or death of the affected muscle cells. One of the most important diagnostic markers for myocardial infarction is troponin, a protein released into the bloodstream when heart muscle is injured. Elevated troponin levels provide a reliable indication that a heart attack has occurred, helping clinicians confirm the diagnosis and guide treatment decisions. Now, we turn our attention to renal physiology, where the kidneys play a pivotal role in sustaining the body's internal balance. These remarkable organs regulate fluid levels, filter waste products, and maintain essential electrolytes. By carefully adjusting the composition of blood, the kidneys ensure that our internal environment remains stable and healthy. Their continuous work is vital for overall homeostasis, highlighting their central importance in human physiology. Acid-base disturbances occur when the body's mechanisms for maintaining pH balance are disrupted. Metabolic acidosis arises when there is an accumulation of acids in the body, often due to increased acid production or decreased acid excretion by the kidneys. This leads to a lower blood pH, making the blood more acidic. In contrast, respiratory alkalosis develops when there is a decrease in carbon dioxide levels, typically caused by rapid or deep breathing. This reduction in CO2 raises the blood's pH, resulting in a more alkaline state. Diuretics are medications that help the body eliminate excess fluid by increasing urine production. Among them, loop diuretics are known for their strong effect, rapidly removing large amounts of sodium and water from the body. However, this potency can lead to a significant loss of potassium, a condition known as hypokalemia. In contrast, thiazide diuretics are less potent but have the unique property of increasing calcium levels in the blood. Understanding these differences is important for choosing the right diuretic based on a patient's specific needs and health conditions. The immune system is a complex network of cells, tissues, and organs that work together to protect the body from harmful invaders such as bacteria, viruses, and other pathogens. Its primary function is to recognize and neutralize these threats, maintaining the body's health and stability. However, the immune system can sometimes become overactive or misdirected, attacking the body's own tissues and leading to various diseases. This dual role highlights the importance of balance within the immune response, as both insufficient and excessive activity can have significant consequences for overall health. Hypersensitivity reactions are classified into 4 distinct types based on their underlying immune mechanisms. Type 1 reactions are IgE-mediated and commonly associated with allergies, such as hay fever or anaphylaxis. Type 2 involves antibodies targeting cells, leading to conditions like hemolytic anemia. Type 3 is characterized by immune complex deposition, which can result in diseases such as systemic lupus erythematosus. Finally, Type 4 hypersensitivity is mediated by T cells, exemplified by reactions like the tuberculosis skin test. Autoimmune diseases occur when the body's immune system mistakenly attacks its own tissues, leading to a range of chronic conditions. Among these, lupus is particularly significant due to its complex presentation and impact on multiple organ systems. Lupus can cause symptoms such as joint pain, skin rashes, and fatigue, making it a diagnostic challenge. Its importance in medical examinations lies in the need for early detection and careful management to prevent serious complications. Understanding lupus is essential for healthcare professionals, as it exemplifies the broader category of autoimmune disorders and their effects on patient health. In summary, understanding the core principles of cardiology, renal physiology, and immunology is essential for a strong foundation in medical science. Key concepts in cardiology include the mechanisms of heart function, common pathologies, and their clinical presentations. Renal physiology highlights the importance of fluid and electrolyte balance, as well as the processes of filtration and reabsorption. Immunology emphasizes the body's defense mechanisms, distinguishing between innate and adaptive immunity. Mastery of these high-yield topics not only aids in academic success, but also enhances clinical decision-making.
Arjun embarks on a fascinating journey through the body's major systems, uncovering the intricate workings that sustain life. As he delves deeper, clinical knowledge begins to illuminate the ordinary, revealing the remarkable processes behind everyday experiences. From the rhythmic beating of the heart to the complex pathways of the nervous system, each discovery offers new insights. Through this exploration, Arjun learns how understanding the body at a clinical level can transform the way we perceive our own health and well-being. The respiratory system plays a vital role in maintaining the body's balance, especially during times of stress. When we encounter stress, our breathing patterns often change, becoming faster and deeper to meet the increased demand for oxygen. This adaptation ensures that more oxygen is transported from the lungs into the bloodstream, supporting the body's heightened activity. Efficient oxygen transport is crucial, as it fuels our cells and helps remove carbon dioxide, a waste product of metabolism. Through these adjustments, the respiratory system helps us respond effectively to both physical and emotional challenges. The oxygen dissociation curve illustrates how readily hemoglobin releases oxygen to the tissues. During exercise, the curve shifts to the right, meaning hemoglobin releases oxygen more easily to meet increased tissue demands. A fever can have a similar effect, as higher temperatures encourage oxygen release. In contrast, carbon monoxide poisoning shifts the curve to the left and reduces the amount of oxygen hemoglobin can carry, making it much harder for tissues to receive the oxygen they need. Understanding these shifts is crucial for recognizing how different conditions impact oxygen delivery throughout the body. Respiratory diseases such as asthma and chronic obstructive pulmonary disease, or COPD, affect the airways and lungs in distinct ways. Asthma is characterized by reversible airway constriction, meaning that with proper treatment, the airways can return to normal function. In contrast, COPD involves progressive, irreversible lung damage, often resulting from long-term exposure to irritants like cigarette smoke. A major component of COPD is emphysema, where the air sacs in the lungs are destroyed, leading to permanent breathing difficulties. Understanding these differences is crucial for accurate diagnosis and effective management. When both liver and lung disease are present in a patient, it is important to consider alpha-1 antitrypsin deficiency as a potential underlying cause. This genetic disorder can lead to chronic obstructive pulmonary disease as well as liver dysfunction, often manifesting as cirrhosis or hepatitis. Recognizing this association is crucial for timely diagnosis and management. In clinical scenarios, identifying the link between these two organ systems can help guide appropriate testing and treatment strategies. The digestive system plays a vital role in transforming the food we eat into the nutrients our bodies need. Each meal sets off a complex process, beginning in the mouth and continuing through a series of specialized organs. Understanding how digestion works not only helps us appreciate the journey of our meals, but also provides valuable insights into common health issues. By linking everyday eating habits with clinical knowledge, we can better recognize the importance of maintaining digestive health. Peptic ulcer disease occurs when open sores develop on the lining of the stomach or the upper part of the small intestine. Stomach acid plays a significant role by eroding the protective mucus layer, making the tissue more vulnerable to damage. Helicobacter pylori, a type of bacteria, can further weaken this protective barrier by causing inflammation and increasing acid production. Together, these factors disrupt the balance between aggressive digestive forces and the stomach's natural defenses, leading to the formation of ulcers. If left untreated, these ulcers can cause pain, bleeding, and other serious complications. Barrett esophagus is a condition that develops as a result of long-term exposure to stomach acid, typically from chronic acid reflux. Over time, the lining of the esophagus undergoes cellular changes, replacing its normal tissue with a type more commonly found in the intestines. This process, known as metaplasia, increases the risk of developing esophageal cancer. While not everyone with Barrett esophagus will develop cancer, regular monitoring is important to detect any further changes early. Understanding this progression helps guide both treatment and surveillance strategies. Inflammatory bowel diseases, such as Crohn's disease and ulcerative colitis, differ significantly in how they affect the digestive tract. Crohn's disease is characterized by skip lesions, meaning areas of healthy tissue are interspersed with segments of inflamed or damaged tissue. In contrast, ulcerative colitis involves continuous inflammation that starts at the rectum and extends proximally through the facies colon without interruption. This distinction in tissue involvement helps clinicians differentiate between the two conditions and guides appropriate treatment strategies. Cirrhosis, a condition marked by severe scarring of the liver, disrupts normal blood flow through the organ. This blockage increases pressure in the portal vein, a major vessel that carries blood from the digestive organs to the liver, resulting in portal hypertension. As pressure builds, blood seeks alternative pathways, often diverting into smaller veins like those in the esophagus. These veins, known as esophageal varices, can become dangerously enlarged and fragile. If they rupture, significant and potentially life-threatening bleeding can occur, making this one of the most serious complications of advanced liver disease. The endocrine system is a complex network of glands that release hormones, acting as chemical messengers throughout the body. These hormones regulate essential functions such as growth, metabolism, and mood, ensuring that various organs work in harmony. When hormone levels are balanced, the body operates smoothly. However, even slight imbalances can lead to significant health issues, affecting everything from energy levels to development. Understanding the endocrine system helps us appreciate the delicate coordination required for overall well-being. Diabetes mellitus is a chronic condition characterized by high blood sugar levels, but it comes in different forms. Type 1 diabetes is an autoimmune disorder where the body's immune system attacks and destroys insulin-producing cells in the pancreas. In contrast, type 2 diabetes is primarily caused by insulin resistance, meaning the body's cells no longer respond effectively to insulin. One serious complication to be aware of is diabetic ketoacidosis, which is most commonly associated with type 1 diabetes. This potentially life-threatening state occurs when the body breaks down fat for energy, leading to a dangerous buildup of acids called ketones in the blood. Thyroid disorders can present with a variety of symptoms, making early recognition important. Graves' disease often leads to symptoms such as unexplained weight loss, rapid heartbeat, and increased nervousness due to an overactive thyroid. In contrast, Hashimoto thyroiditis typically causes fatigue, weight gain, and sensitivity to cold as the thyroid becomes underactive. Both conditions may also result in noticeable changes in the neck, such as swelling or discomfort. Understanding these distinct signs can help guide timely diagnosis and effective management. Adrenal gland disorders can significantly impact hormone balance in the body. Cushing's syndrome results from an excess of cortisol, leading to symptoms such as weight gain, a rounded face, and thinning skin. In contrast, Addison disease is caused by a deficiency of cortisol, often presenting with fatigue, weight loss, and darkening of the skin. Recognizing these characteristic symptoms is crucial for timely diagnosis and effective management of these conditions. Pheochromocytoma is a rare tumor that develops in the adrenal glands, leading to the excessive production of hormones like adrenaline and noradrenaline. This hormonal surge can cause sudden episodes of high blood pressure, known as episodic hypertension. Patients may experience symptoms such as headaches, sweating, palpitations, and anxiety during these episodes. Identifying pheochromocytoma is crucial, as untreated cases can result in serious cardiovascular complications. Diagnosis typically involves specialized blood and urine tests, followed by imaging studies to locate the tumor. Exam anxiety can have a profound impact on brain function, particularly in regions responsible for memory, attention, and decision-making. When under stress, the body releases hormones like cortisol, which can disrupt neural communication and impair cognitive performance. This heightened state of anxiety may also influence the localization of neurological deficits, sometimes causing symptoms to appear or worsen in specific areas of the brain. Understanding these effects helps explain why some individuals experience lapses in recall or concentration during high-pressure situations. Ultimately, managing stress is crucial for maintaining optimal neurological health and function during exams. Strokes affecting the middle cerebral artery often result in characteristic patterns of weakness on one side of the body. This artery supplies a large portion of the brain responsible for movement and sensation, particularly in the face and arm. When a blockage occurs, patients may experience weakness or paralysis predominantly in these areas, while the leg is often less affected. Additionally, language difficulties can arise if the stroke impacts the dominant hemisphere. Recognizing these patterns helps clinicians quickly identify the location and extent of the stroke. Neurodegenerative diseases, such as Parkinson's and Alzheimer's, are characterized by the progressive loss of nerve cells in the brain. In Parkinson's disease, the degeneration primarily affects dopamine-producing neurons, leading to symptoms like tremors, muscle rigidity, and slowed movement. Alzheimer's disease, on the other hand, is marked by the accumulation of abnormal protein deposits, resulting in memory loss, confusion, and changes in behavior. Both conditions worsen over time, profoundly impacting daily functioning and quality of life. Understanding their underlying mechanisms is crucial for developing effective treatments. Guillain-Barré syndrome is a rare but serious neurological disorder that often develops after a respiratory or gastrointestinal infection. One of its hallmark features is ascending paralysis, where muscle weakness begins in the legs and gradually moves upward to affect the arms and upper body. Early recognition is crucial, as the condition can progress rapidly and may compromise breathing if not treated promptly. Patients may also experience tingling sensations, loss of reflexes, and difficulty with coordination. Timely medical intervention can significantly improve outcomes and reduce the risk of long-term complications. In myasthenia gravis, muscle weakness often changes depending on activity and rest. Typically, muscles become weaker with repeated use or sustained activity, making tasks like climbing stairs or holding objects more difficult as time goes on. However, after a period of rest, muscle strength usually improves, allowing for temporary recovery. This pattern of fluctuating weakness is a hallmark of the condition and can affect different muscle groups at various times. Understanding these fluctuations is important for managing daily activities and planning periods of rest. Arjun's journey through the complexities of human physiology and pathology has fostered a comprehensive understanding of how major organ systems interact and respond to disease. By connecting foundational principles with clinical manifestations, he is able to appreciate the delicate balance that sustains health. This integrated perspective not only enhances his diagnostic abilities, but also deepens his empathy for patients experiencing multifaceted illnesses. Ultimately, Arjun's holistic approach equips him to navigate the challenges of modern medicine with both knowledge and compassion.
Renal integration plays a crucial role in maintaining the body's overall balance. The kidneys regulate acid-base status by adjusting the excretion of hydrogen ions and bicarbonate, helping to correct disturbances that can arise from various conditions. When these imbalances occur, the body employs compensation mechanisms, such as respiratory or metabolic adjustments, to restore equilibrium. Additionally, understanding the clinical differences between nephrotic and nephritic syndromes is essential, as each presents with distinct features and implications for kidney function. These insights underscore the kidney's vital contribution to systemic health. Arjun learns that hormones play a crucial role in regulating the menstrual cycle, orchestrating the complex interactions that enable reproduction. He identifies important clinical patterns such as polycystic ovary syndrome, which can disrupt normal cycles, and molar pregnancy, a rare condition affecting early gestation. Additionally, Arjun reviews various genetic syndromes that impact sexual development, deepening his understanding of how genetics can influence reproductive health. Through these studies, he gains a comprehensive view of the factors that shape reproductive function. Musculoskeletal and dermatologic conditions encompass a wide range of disorders, each with distinct underlying mechanisms. Joint diseases such as rheumatoid arthritis involve immune-mediated inflammation, while osteoarthritis is primarily driven by the gradual breakdown of cartilage. Crystal arthropathies, including gout and pseudogout, present unique diagnostic challenges due to the deposition of crystals within joints. In dermatology, major blistering skin diseases are characterized by specific patterns of blister formation and immune involvement, helping to distinguish between conditions like pemphigus vulgaris and bullous pemphigoid. Understanding these mechanisms is crucial for accurate diagnosis and effective management. Pathology provides essential insights into the mechanisms of disease. By studying different types of cell death, we gain a deeper understanding of how tissues respond to injury and stress. This knowledge is crucial in tracing the steps that can lead to cancer development. Additionally, tumor markers play a significant role in diagnosing and monitoring various cancers, helping clinicians make informed decisions about patient care. Biostatistics plays a crucial role in understanding and answering exam questions accurately. Key concepts include sensitivity, which measures a test's ability to correctly identify those with a condition, and specificity, which assesses how well a test identifies those without it. Predictive values help determine the likelihood that a test result reflects the true condition. Additionally, understanding type 1 errors or false positives and type 2 errors or false negatives is vital for interpreting research findings and making informed decisions. The key to excelling on the USMLE lies in connecting concepts across different medical systems rather than relying solely on memorization. By understanding how various topics interrelate, you can better apply your knowledge to complex clinical scenarios. This integrated approach not only improves test performance, but also prepares you for real-world medical practice. Ultimately, focusing on comprehension and synthesis will lead to lasting success.
Arjun steps into the exam hall, the quiet hum of anticipation filling the air. He finds his seat, carefully arranging his stationery and taking a deep breath to steady his nerves. Today's exam is unlike any other, featuring complex, story-based questions that require not just knowledge, but creativity and critical thinking. As he glances around, he notices his classmates are equally focused, each preparing for the challenge ahead. The atmosphere is tense, but Arjun feels ready to tackle whatever the test may bring. Arjun faces his first clinical challenge: a patient presenting with low blood pressure. Drawing on his medical knowledge, he methodically reviews the primary causes of shock. He considers whether the issue stems from the heart itself, as in cardiogenic shock, a loss of blood or fluids leading to hypovolemic shock, or a severe infection resulting in septic shock. By organizing his thoughts around these categories, Arjun prepares to gather more information and narrow down the diagnosis. Understanding the clinical trap in shock questions is crucial, especially when distinguishing between early and late septic shock. Early septic shock typically presents with warm, flushed skin due to peripheral vasodilation, while late septic shock is characterized by cool, clammy skin as the body's compensatory mechanisms fail. NBME exams frequently test this transition, requiring careful attention to subtle changes in patient presentation. Recognizing these differences can help avoid common pitfalls and ensure accurate diagnosis in both clinical practice and exam scenarios. Arjun is presented with a clinical scenario involving a patient who experiences shortness of breath, yet their oxygen saturation levels appear normal. This situation prompts him to consider less obvious causes of respiratory distress. He recognizes that carbon monoxide poisoning can present in this way, as the gas binds to hemoglobin and prevents effective oxygen delivery, despite normal readings on standard pulse oximetry. Understanding this classic presentation is crucial for timely diagnosis and treatment, as symptoms may be subtle and easily overlooked. Carbon monoxide poisoning can be deceptive because pulse oximetry readings may appear normal, even when oxygen delivery to tissues is compromised. This occurs because pulse oximeters cannot distinguish between hemoglobin bound to oxygen and hemoglobin bound to carbon monoxide. As a result, the device may falsely indicate adequate oxygen saturation. Additionally, carbon monoxide binding causes a leftward shift in the oxygen dissociation curve, meaning hemoglobin holds on to oxygen more tightly and releases less to the tissues. This combination leads to tissue hypoxia despite seemingly normal oxygen saturation levels. Arjun approaches the acid-base disorder question by carefully analyzing the laboratory results. He notes that the patient's pH is low, indicating acidosis, while both CO2 and bicarbonate levels are also reduced. This pattern suggests that the primary disturbance is metabolic acidosis, as the decrease in bicarbonate is the main contributor to the acidotic state. The low CO2 reflects a compensatory respiratory response, where the body attempts to offset the acid-base imbalance by increasing ventilation. Through this interpretation, Arjun accurately identifies the underlying disorder and the physiological mechanisms involved. In metabolic acidosis, the body responds by increasing respiratory rate to expel more carbon dioxide, thereby reducing acidity and helping to restore balance. This process, known as respiratory compensation, is a crucial adaptive mechanism. However, it is important to recognize that not all acid-base disturbances are straightforward. Mixed acid-base disorders can occur, where multiple imbalances coexist, making diagnosis and management more complex. Identifying these mixed disorders is a frequent focus on NBME exams, emphasizing the need for careful interpretation of laboratory values and clinical context. The NBME exam stands out for its distinctive approach to assessing medical knowledge. Rather than focusing on rote memorization, the exam emphasizes the ability to recognize patterns and integrate information from various disciplines. This means that questions often require critical thinking and the application of concepts rather than simple recall of facts. As a result, successful test takers must develop strong analytical skills and the capacity to connect different areas of learning. Recognizing the nuances in neurological symptoms is crucial for accurately diagnosing stroke syndromes. For example, the specific pattern of limb weakness can reveal important clues about the location and type of brain lesion. A patient with weakness predominantly in the arm may have a different underlying issue than one with leg-dominant weakness. These subtle distinctions help clinicians differentiate between various stroke syndromes, ensuring that treatment is both timely and targeted. Understanding these patterns is essential for effective neurological assessment. Distinguishing between middle cerebral artery, or MCA, and anterior cerebral artery, or ACA, strokes relies on understanding their unique symptom patterns. MCA strokes often present with weakness or sensory loss affecting the face and arm more than the leg, as well as possible language deficits if the dominant hemisphere is involved. In contrast, ACA strokes typically cause weakness and sensory loss that is more pronounced in the leg than in the arm or face, and may also lead to behavioral changes or urinary incontinence. On NBME exams, questions often highlight these differences by describing which body regions are most affected or by including clues about speech or personality changes. Recognizing these subtle distinctions is key to answering related test questions accurately. When preparing for the NBME exams, it's important to understand that questions often focus on drug side effects rather than simply asking for drug names. Clinical vignettes are commonly used to present scenarios where a patient develops new symptoms after starting a medication. Recognizing these side effects can be crucial for selecting the correct answer. By familiarizing yourself with common adverse reactions, you'll be better equipped to interpret these clinical clues and succeed on the exam. Certain medications are well known for their characteristic side effects. For example, ACE inhibitors, commonly used to treat high blood pressure, are frequently associated with a persistent dry cough. Another notable association is with fluoroquinolone antibiotics, which can increase the risk of tendon rupture, particularly in older adults. Recognizing these classic side effects is important for both healthcare providers and patients to ensure safe and effective treatment. Recognizing infectious diseases often relies on identifying hallmark clinical features and understanding characteristic patterns. Certain infections present with unique combinations of symptoms, such as fever, rash, or specific organ involvement, which can guide clinicians toward a diagnosis. By observing these patterns and correlating them with patient history and epidemiological factors, healthcare providers can narrow down potential causes. This approach enhances diagnostic accuracy and supports timely, effective treatment decisions. Certain infectious diseases present with distinctive patterns that aid in their diagnosis. For instance, measles is often identified by the appearance of Koplik spots, which are small white lesions inside the mouth that precede the characteristic skin rash. Cholera, on the other hand, is known for causing profuse, watery diarrhea that resembles rice water. These clinical features are not only important for recognition, but also reflect the underlying mechanisms of each disease. In measles, the virus triggers immune responses leading to mucosal lesions, while in cholera, the bacterial toxin disrupts water balance in the intestines, resulting in severe dehydration. Genetics can be full of surprises, especially when it comes to parent of origin effects on chromosomal deletions. This phenomenon occurs when the same segment of a chromosome is missing, but the outcome depends on whether the deletion was inherited from the mother or the father. For example, a deletion on chromosome 15 inherited from the father can result in Prader-Willi syndrome, while the same deletion from the mother leads to Angelman syndrome. These differences arise because certain genes are only active when inherited from one parent, a process known as genomic imprinting. Understanding these mechanisms helps explain why seemingly similar genetic changes can produce distinct syndromes. Prader-Willi and Angelman syndromes are both genetic disorders caused by deletions on chromosome 15, but the key difference lies in the parent of origin. In Prader-Willi syndrome, the deletion occurs on the paternal chromosome, meaning the father's genetic material is missing. Conversely, Angelman syndrome results from a deletion on the maternal chromosome, so the mother's genetic contribution is lost. This distinction is crucial for diagnosis and is a common point of confusion on exams. Remembering which parent's chromosome is affected can help avoid this classic trap. The immune system can sometimes become confused, leading to hypersensitivity reactions that damage the body's own tissues. These reactions are classified into different types, each with distinct mechanisms and outcomes. In the context of post-infectious kidney disease, it's particularly important to distinguish between these types, as they can influence both diagnosis and treatment. For example, some reactions involve immune complexes depositing in the kidneys, while others may be driven by direct antibody attacks. Understanding these differences helps clinicians tailor their approach to managing kidney complications after infections. Understanding immune mechanisms is crucial when analyzing clinical scenarios like glomerulonephritis. In type 2 hypersensitivity, antibodies target specific antigens on the surface of kidney cells, leading to direct cell damage. In contrast, type 3 hypersensitivity involves the formation of immune complexes that deposit in the glomeruli, triggering inflammation and tissue injury. Recognizing these differences helps guide diagnosis and treatment, as each mechanism results in distinct patterns of kidney involvement and clinical presentation. Cardiac murmurs often present a diagnostic challenge, but their radiation patterns can provide valuable clues. For example, a murmur that radiates to the carotids is typically associated with aortic stenosis, while one that radiates to the axilla suggests mitral regurgitation. The NBME emphasizes these patterns because they help distinguish between different valvular heart diseases, which may have overlapping symptoms. Recognizing these clues not only aids in accurate diagnosis, but also demonstrates a deeper understanding of cardiac physiology and pathology. Tumor progression is a stepwise process that begins with normal tissue. Over time, certain cells may undergo metaplasia, where one type of mature cell is replaced by another type better suited to withstand stress. If harmful influences persist, these cells can develop dysplasia, marked by abnormal growth and changes in cellular appearance. Eventually, these dysplastic cells may transform into carcinoma, a malignant tumor capable of invading surrounding tissues. Understanding this sequence is crucial for early detection and intervention, as recognizing precancerous changes can significantly improve patient outcomes. Distinguishing between nephrotic and nephritic syndromes is essential in pediatric medicine. Nephrotic syndrome typically presents with heavy proteinuria, edema, and low blood albumin levels, often without significant blood in the urine. In contrast, nephritic syndrome is marked by hematuria, hypertension, and varying degrees of kidney dysfunction, usually accompanied by less severe protein loss. Recognizing these classic presentations helps guide further evaluation and management, ensuring timely and appropriate care for affected children. Myasthenia gravis and Lambert-Eaton syndrome are both disorders that affect the communication between nerves and muscles, but they display distinct patterns when it comes to symptom improvement. In myasthenia gravis, muscle weakness typically worsens with continued activity and improves with rest. Conversely, Lambert-Eaton syndrome often presents with muscle strength that actually improves after repeated use or exercise. Recognizing these contrasting patterns can be crucial for distinguishing between the two conditions and guiding appropriate treatment strategies. Cushing's syndrome is a disorder characterized by excessive cortisol production, often leading to symptoms like central obesity, muscle weakness, and skin changes. However, when preparing for exams such as the NBME, it's important to focus on the underlying mechanisms rather than just memorizing the diagnosis. Questions may explore the feedback loops involving the hypothalamus, pituitary, and adrenal glands, or the effects of prolonged cortisol exposure on various organ systems. Understanding these physiological pathways helps in recognizing both classic presentations and subtle variations of the syndrome. This integrated approach ensures a deeper grasp of endocrine disorders and their systemic impacts. A crucial insight emerges when preparing for NBME exams. These questions are designed to assess more than just rote memorization. Instead, they challenge your ability to reason through complex scenarios, integrate information from various topics, and recognize underlying patterns. Success depends on connecting concepts and applying knowledge in unfamiliar contexts. Understanding this approach can transform your study strategy, guiding you to focus on critical thinking and synthesis rather than isolated facts. Adopting the NBME mindset involves following 5 essential rules when tackling exam questions. First, always identify the system being tested, as this provides crucial context for your answer. Next, focus on recognizing key clues within the question stem, which often point directly to the correct response. Mechanism-based thinking is also important. Understanding the underlying processes can help you reason through complex scenarios. By consistently applying these strategies, you can approach each question with greater confidence and accuracy. When tackling NBME exams, it's important to be aware of common traps that can mislead test takers. These often include answer choices that are direct opposites or subtle reversals of the correct response. Sometimes, questions present clinical scenarios with only slight differences, making it easy to overlook key details. Recognizing these patterns can help you avoid common pitfalls and select the most accurate answer. Staying attentive to these nuances is essential for success on exam day. Grasping the connections between biochemistry, pathology, and pharmacology is essential for mastering NBME questions. These disciplines often overlap, requiring a comprehensive understanding rather than isolated memorization. By recognizing how they interrelate, you can more effectively analyze complex scenarios and identify the underlying mechanisms at play. Ultimately, seeing the bigger picture not only improves test performance, but also deepens your overall understanding of medical science. Arjun starts to understand that metabolism isn't just a collection of separate topics, but a vast and interconnected network. As he studies further, he notices how different metabolic pathways interact and influence each other. This realization helps him appreciate the complexity and elegance of the body's biochemical processes. It marks a turning point in his learning as he begins to see the bigger picture behind individual reactions. When blood glucose levels drop, the body responds by breaking down glycogen stores to quickly release glucose into the bloodstream. If these stores become depleted, the body initiates gluconeogenesis, a process that creates new glucose from non-carbohydrate sources. Importantly, glycogen breakdown and gluconeogenesis are tightly regulated and do not occur at the same time. This separation ensures that the body manages its energy resources efficiently, as these processes have opposing energy demands. Such regulation helps maintain stable glucose levels and supports overall metabolic balance. Metabolic pathways like gluconeogenesis and glycolysis play crucial roles in managing the body's energy balance. Glycolysis breaks down glucose to produce energy, which is essential for cellular functions. In contrast, gluconeogenesis synthesizes glucose from non-carbohydrate sources, a process that actually consumes energy. To maintain efficiency, the body tightly regulates these pathways, preventing them from operating simultaneously. This coordination ensures that energy is neither wasted nor depleted unnecessarily. When alcohol is consumed, it raises the levels of NADH in the body. This increase in NADH interferes with gluconeogenesis, the process by which the body generates new glucose. As a result, blood sugar levels can drop, potentially leading to hypoglycemia. Additionally, the excess NADH promotes the conversion of pyruvate to lactate, increasing the risk of lactic acidosis. These metabolic effects are important to remember, as they frequently appear as pitfalls in medical exams. Electrolytes play a vital role in maintaining the body's physiological balance. Arjun appreciates how even minor disturbances in electrolyte levels can lead to significant clinical consequences. Often, these imbalances manifest with subtle symptoms that may be easily overlooked, yet they can quickly escalate to critical conditions if not addressed. Recognizing these signs early is essential for effective patient care and intervention. Potassium plays a crucial role in maintaining normal heart rhythm. Elevated potassium levels, known as hyperkalemia, can cause distinctive peaked T waves on an electrocardiogram and increase the risk of dangerous arrhythmias. Conversely, low potassium, or hypokalemia, often results in the appearance of U waves and can also disrupt cardiac function. It's important to assess potassium levels, especially in cases involving kidney issues or certain medications, as these factors commonly affect potassium balance. Calcium levels in the body are tightly regulated by parathyroid hormone. When calcium is too low, it can lead to symptoms such as tetany, which involves muscle spasms, and even seizures. On the other hand, high calcium levels may cause kidney stones, bone pain, and a range of abdominal symptoms. Maintaining the right balance is essential for proper nerve, muscle, and bone function. Disruptions in this regulation can have significant effects on overall health. Sodium disorders can have significant effects on the body, particularly the nervous system. Low sodium levels, a condition known as hyponatremia, may result in confusion and seizures, and are frequently observed in disorders like SYADH. On the other hand, high sodium levels, or hypernatremia, often lead to dehydration. Both conditions commonly present with neurological symptoms, making prompt recognition and management essential. Understanding these signs is crucial for effective treatment and patient safety. Arjun begins to grasp the concept of hemodynamics by examining pressure-volume loops. He learns that preload refers to the initial stretching of the heart muscle before contraction, while afterload is the resistance the heart must overcome to eject blood. By observing how variations in preload and afterload alter the shape and size of the pressure-volume loop, Arjun sees their direct impact on cardiac output. This understanding helps him appreciate how the heart adapts to different physiological conditions. Gas exchange in the lungs relies on a delicate balance between ventilation, the movement of air into and out of the alveoli, and perfusion, the flow of blood through the pulmonary capillaries. When this balance is disrupted, it leads to what is known as a ventilation perfusion, or V/Q, mismatch. Two important concepts help us understand these mismatches. Dead space and shunt. Dead space refers to areas of the lung that are ventilated but not perfused, meaning air reaches the alveoli, but no gas exchange occurs because blood flow is absent. In contrast, a shunt occurs when blood flows through the lungs without being oxygenated, typically because the alveoli are not ventilated, preventing oxygen from entering the bloodstream. Arjun approaches learning by concentrating on how neurotransmitter levels shift in the brain, rather than simply memorizing lists of diseases. This method allows him to connect specific symptoms directly to the underlying chemical imbalances that cause them. By understanding these patterns, Arjun can better predict which neurotransmitters are involved in various conditions. This approach not only deepens his comprehension, but also helps him apply his knowledge more flexibly in clinical scenarios. Arjun quickly realizes that, when studying for exams, recognizing the unique side effects of medications can be even more crucial than memorizing their intended uses. Certain adverse reactions are so distinctive that they serve as valuable diagnostic clues, helping to identify specific drugs. By focusing on these hallmark side effects, Arjun is able to differentiate between similar medications with greater accuracy. This approach not only streamlines his study process, but also enhances his ability to answer challenging exam questions effectively. Arjun approaches infection cases by focusing on the site of infection rather than relying solely on memorized lists. By identifying where the infection is located, he can narrow down the most probable organisms responsible. This method allows him to select treatments that are specifically targeted to the likely pathogens. As a result, his diagnostic process becomes more efficient and clinically relevant. This strategy not only streamlines decision-making, but also enhances patient care. Hormone regulation in the body relies on intricate feedback loops. These mechanisms ensure that hormone levels remain balanced by adjusting production based on the body's needs. For Arjun, understanding how negative and positive feedback loops operate allows him to pinpoint where disruptions may occur. This knowledge is essential in diagnosing endocrine disorders, as it helps trace symptoms back to their underlying causes within the hormonal system. Understanding acid-base balance becomes easier when you remember that the lungs are responsible for controlling carbon dioxide, while the kidneys manage bicarbonate levels. When an imbalance occurs, the body uses compensation mechanisms to restore equilibrium. For example, if there's too much acid, the kidneys can increase bicarbonate reabsorption to help neutralize it. Conversely, if there's too much base, the lungs may retain more carbon dioxide to compensate. This interplay between the lungs and kidneys is essential for maintaining the body's pH within a healthy range. The NBME frequently challenges students with questions about conditions that display opposite patterns. For example, myasthenia gravis and Lambert-Eaton syndrome both cause muscle weakness, but their underlying mechanisms and clinical presentations differ significantly. Similarly, early and late septic shock present with contrasting hemodynamic profiles. Recognizing these opposing features is essential for accurate diagnosis and effective management. Being able to distinguish between such conditions can help avoid common pitfalls on exam day. Understanding how vitamin D and parathyroid hormone interact with bone is crucial for grasping calcium and phosphate regulation. Vitamin D primarily increases the absorption of both calcium and phosphate from the gut, promoting bone mineralization. In contrast, parathyroid hormone raises blood calcium levels by stimulating bone resorption and increasing renal reabsorption of calcium, while simultaneously decreasing phosphate reabsorption in the kidneys. This distinction is frequently tested, as it highlights the opposing effects these hormones have on phosphate balance. Recognizing these mechanisms helps clarify their roles in maintaining mineral homeostasis. Arjun approaches the study of cancer by concentrating on the fundamental genetic changes that drive the disease. Instead of memorizing the many types of cancer, he examines key mutations, like the loss of tumor suppressor genes or the activation of oncogenes. This method allows him to understand how these alterations disrupt normal cell regulation and lead to uncontrolled growth. By focusing on the underlying mechanisms, Arjun gains a deeper insight into cancer pathogenesis. Arjun approaches biostatistics with a strategic mindset, viewing it as a chance to secure straightforward marks. He focuses on mastering the concepts of sensitivity and specificity, recognizing their importance in medical testing. Sensitivity measures a test's ability to correctly identify those with a disease, while specificity assesses its accuracy in ruling out those without the condition. By understanding when to apply these concepts, using sensitivity for screening tests and specificity for confirmation, Arjun maximizes his performance in this subject area. At the final level of thinking, Arjun tackles each question by searching for patterns that reveal deeper insights. He treats symptoms as valuable clues, piecing them together to form a clearer picture of the problem at hand. By consistently connecting answers to their underlying mechanisms, Arjun uncovers the root causes behind each scenario. This methodical approach allows him to move beyond surface details and develop a comprehensive understanding of complex issues.
Arjun has developed an integrated approach to clinical reasoning, moving beyond the traditional separation of medical subjects. He now views each patient as a complete physiological narrative, considering how various systems interact within the individual. This perspective allows him to connect symptoms and findings across different disciplines, leading to a more comprehensive understanding of each case. By focusing on the whole patient rather than isolated topics, Arjun enhances both his diagnostic accuracy and the quality of care he provides. Fatigue, unexplained weight loss, and darkening of the skin are hallmark symptoms that may point to adrenal insufficiency. This condition arises when the adrenal glands fail to produce adequate amounts of essential hormones, such as cortisol and aldosterone. The hormonal cascade begins in the brain, where the pituitary gland signals the adrenals to release these hormones. When this system is disrupted, the body struggles to maintain energy, regulate metabolism, and balance salt and water. As a result, patients experience a range of clinical consequences that can significantly impact daily life. Understanding the adrenal gland's function is essential for anticipating certain clinical findings. The adrenal cortex produces glucocorticoids and mineralocorticoids, hormones that play a vital role in maintaining blood pressure, sodium, and potassium balance. When adrenal function is compromised, patients may develop hypotension due to reduced aldosterone and cortisol levels. This can also lead to hyponatremia, or low sodium, and hyperkalemia, or elevated potassium, as the body struggles to regulate these electrolytes. Recognizing these patterns helps in early identification and management of adrenal insufficiency. When evaluating chest pain, it's important to systematically consider a range of possible causes. One of the first steps is distinguishing between cardiac and pulmonary origins, as each presents with distinct clinical features. Cardiac-related chest pain often manifests as pressure or tightness, sometimes radiating to the arm or jaw, and may be associated with exertion or emotional stress. In contrast, pulmonary causes such as pneumonia or pulmonary embolism are more likely to present with sharp pain that worsens with breathing or coughing. Careful assessment of these characteristics helps guide further diagnostic and management decisions. Myocardial infarction begins when a coronary artery becomes blocked, often due to a buildup of atherosclerotic plaque or a sudden blood clot. This obstruction restricts the flow of oxygen-rich blood to a portion of the heart muscle. Without adequate oxygen, the affected tissue quickly becomes ischemic, meaning it is deprived of the oxygen and nutrients it needs to function. If the blockage persists, the ischemic tissue starts to die, a process known as necrosis. This sequence of events underlies the serious and sometimes fatal consequences of a heart attack. Pulmonary causes of chest pain, like a pulmonary embolism, often present with distinct features that help differentiate them from other conditions. The pain may be sharp and worsen with deep breathing or coughing. Associated symptoms can include sudden shortness of breath, rapid heartbeat, and sometimes coughing up blood. Careful analysis of these pain characteristics and accompanying signs is essential for accurate identification and timely management of pulmonary issues. In renal cases, monitoring fluid and electrolyte shifts is essential for effective patient management. When vomiting occurs, the body loses significant amounts of stomach acid, primarily hydrochloric acid. This loss leads to a rise in blood pH, resulting in metabolic alkalosis. To compensate, the body may decrease respiratory rate to retain carbon dioxide, which helps lower the pH back toward normal. Additionally, the kidneys adjust by excreting bicarbonate, further aiding in the restoration of acid-base balance. Mixed acid-base disorders can be challenging to identify, as they involve more than one primary disturbance occurring simultaneously. To accurately diagnose these conditions, it is essential to assess whether the body's physiological compensation matches what would be expected for a single disorder. This involves analyzing blood gas values and comparing the observed compensation to established norms. The kidneys play a crucial regulatory role, adjusting bicarbonate reabsorption and hydrogen ion excretion to help restore balance. By carefully evaluating these compensatory mechanisms, clinicians can uncover the presence of mixed acid-base disturbances and guide appropriate treatment. Identifying drug side effects can serve as valuable diagnostic shortcuts in clinical practice. For example, a persistent cough in a patient taking ACE inhibitors often points to the medication as the cause. Similarly, tendon pain that develops after starting fluoroquinolones may indicate a drug-related adverse effect. Recognizing these associations helps clinicians quickly pinpoint the source of symptoms and adjust treatment accordingly. Pattern recognition is a valuable tool in neurology, particularly when it comes to localizing lesions based on clinical deficits. For example, if a patient presents with speech difficulties, identifying involvement of Broca's area can help pinpoint the affected region of the brain. Similarly, coordination problems often suggest issues within the cerebellum. By observing specific symptoms and matching them to known neurological pathways, clinicians can more accurately determine the location and nature of neurological damage. This approach enhances diagnostic accuracy and informs targeted treatment strategies. In clinical practice, understanding the context in which an infection arises is crucial for identifying the responsible organism. Differentiating between hospital-acquired and community-acquired infections helps narrow down the list of potential pathogens, as each setting is associated with distinct microbial profiles. By carefully analyzing a patient's symptoms and considering their recent exposures, clinicians can make informed decisions about the most likely infectious agents. This targeted approach not only guides appropriate diagnostic testing, but also supports the selection of effective treatments. Endocrine feedback loops are essential mechanisms that help the body maintain balance by regulating hormone levels. These loops often involve a series of signals between glands and target organs, where an increase or decrease in one hormone triggers adjustments in others. By recognizing these logical patterns, it becomes easier to analyze and solve complex hormonal questions. Understanding how feedback loops operate allows for efficient identification of causes and effects within the endocrine system, leading to more accurate conclusions. Pathology can be understood as a continuous process, beginning with cellular injury and progressing through stages of adaptation, dysplasia, and ultimately malignancy. This perspective emphasizes the importance of recognizing how cells respond and change over time, rather than simply memorizing isolated facts. By focusing on the underlying mechanisms, we gain a deeper appreciation for how normal cellular responses can, under persistent stress or damage, lead to abnormal growth and cancer. This approach allows for a more integrated understanding of disease development and progression. Understanding sensitivity and specificity becomes much easier when we apply clinical logic. Sensitivity measures how well a test identifies those with a condition, while specificity assesses how accurately it rules out those without it. By focusing on these definitions, you can quickly determine which answers are logically inconsistent with the test's purpose. This approach streamlines decision-making, allowing for faster and more accurate elimination of incorrect options. In summary, the heart of the USMLE lies in the ability to interpret clinical scenarios, not just recall isolated facts. Success depends on recognizing important details within patient stories and piecing together these clues to form accurate diagnoses. This approach mirrors real-world medical practice, where critical thinking and integration of information are essential. By focusing on understanding and application rather than memorization, candidates are better prepared for both the exam and their future roles as physicians. Arjun begins his exam with a clear focus on understanding rather than memorizing. He believes that recognizing concepts and patterns is far more effective than simply recalling facts. As he approaches the first questions, Arjun carefully reads each one, looking for familiar themes and connections. This mindset allows him to confidently tackle the exam, relying on comprehension and logical reasoning rather than rote memory. By prioritizing recognition, Arjun sets a strong foundation for his performance throughout the test. Arjun quickly scans each clinical vignette, focusing on identifying crucial triggers that hint at the underlying diagnosis. By honing in on specific symptoms, patient demographics, and unique findings, he is able to anticipate the most likely diagnosis even before considering the answer choices. This approach demonstrates the power of rapid pattern recognition, allowing for efficient and accurate decision-making. Arjun's method highlights the importance of recognizing key details that differentiate similar conditions in a clinical setting. Arjun is meticulous when it comes to analyzing critical clues. He knows that certain medical conditions can appear deceptively similar, leading to common diagnostic pitfalls. For example, both vitamin B12 and folate deficiencies can cause anemia, but only B12 deficiency can result in irreversible neurological damage if left untreated. By carefully verifying laboratory results and clinical signs, Arjun ensures he accurately distinguishes between the two, preventing misdiagnosis and ensuring the best possible care for his patients. When faced with complex and lengthy vignettes, it is important to focus on extracting the core information that directly relates to the patient's condition. This involves identifying key symptoms, relevant medical history, and any critical findings that point toward a diagnosis. By filtering out extraneous details, you can streamline your thought process and avoid distractions. This approach not only saves time but also increases the accuracy of your diagnostic reasoning. Pattern recognition plays a crucial role in distinguishing between medical conditions that present with similar symptoms. For example, both Lambert-Eaton syndrome and myasthenia gravis can cause muscle weakness, but careful analysis reveals key differences. Lambert-Eaton syndrome often begins with weakness in the legs and may improve with repeated activity, while myasthenia gravis typically starts with eye or facial muscle involvement and worsens with exertion. Recognizing these subtle distinctions allows clinicians to make more accurate diagnoses and tailor treatment appropriately. Interpreting lab values efficiently often involves identifying the primary disturbance rather than performing extensive calculations. By focusing on key indicators such as pH, bicarbonate, and carbon dioxide levels, clinicians can quickly determine whether the issue is metabolic or respiratory in nature. This approach streamlines decision-making and allows for faster clinical responses. Recognizing patterns and common presentations helps guide the interpretation, making it easier to prioritize patient care. Ultimately, relying on recognition of primary disturbances enhances both speed and accuracy in clinical assessments. Managing mental fatigue during an exam is crucial for maintaining peak performance. Taking brief moments to reset your focus can help clear your mind and reduce stress. Adjusting your posture periodically not only improves comfort, but also enhances alertness. By staying attentive and preventing the accumulation of small errors, you can ensure greater accuracy throughout the test. These strategies work together to help you stay sharp and perform your best under pressure. Recognizing patterns in clinical presentations can significantly streamline the diagnostic process. For instance, when a patient presents with rust-colored sputum, experienced clinicians often associate this finding with Streptococcus pneumonia infection. By quickly linking familiar clues to likely causes, healthcare providers can focus their efforts more efficiently. This approach not only saves valuable time, but also enhances the accuracy of early decision-making. When faced with challenging questions, it can be beneficial to mark them for later review rather than spending excessive time initially. This approach allows you to move forward efficiently, addressing questions you are more confident about. Returning to difficult items with a fresh perspective often leads to clearer thinking and improved problem-solving. Additionally, reviewing marked questions after completing the rest of the material can help reduce anxiety and provide new insights. This strategy supports effective time management and enhances overall performance during assessments. As the final phase of the block approaches, time pressure intensifies and decisions must be made quickly. In these moments, relying on instinct becomes essential, allowing for swift yet effective responses. By trusting one's training and experience, it's possible to maintain accuracy without falling into the trap of overanalyzing. This balance between speed and precision is key to performing well under pressure. Ultimately, adapting to these demands ensures consistent results, even in the most challenging situations. When reviewing marked questions, it's important to approach them with a refreshed perspective. Often, your first instinct is correct, so trust your initial answer unless you find clear evidence that supports making a change. Overthinking can sometimes lead to unnecessary doubt and mistakes. Carefully weigh any new insights before deciding to alter your response. This balanced approach can help improve accuracy and confidence during assessments. In summary, mastering process control and structured thinking is essential for achieving success in exams. By approaching each question independently, you minimize the risk of confusion and ensure that your answers are clear and focused. This disciplined approach not only helps you manage your time effectively, but also boosts your confidence during the test. Remember, consistent practice of these strategies can make a significant difference in your overall performance. Arjun began his medical studies relying heavily on rote memorization, diligently committing facts and figures to memory. However, he soon realized that this approach left him disconnected from the real-world application of his knowledge. As he progressed, Arjun started visualizing actual patient cases, which brought the material to life and deepened his understanding. This marked a significant shift in his learning journey, transforming abstract concepts into meaningful clinical scenarios. A middle-aged man arrives, exhibiting the hallmark signs of a heart attack. Arjun envisions what's happening inside the body. A coronary artery has become blocked, cutting off blood flow to a portion of the heart muscle. This deprivation leads to cell death, a process known as myocardial infarction. As heart cells are damaged, they release troponin into the bloodstream, a key marker used to confirm the diagnosis. The man's chest pain may also radiate to his arm or jaw, a phenomenon called referred pain, which occurs because the nerves supplying the heart and these areas share common pathways. A pale and unsteady patient presents a unique diagnostic challenge, highlighting the subtle differences between types of anemia. Arjun carefully examines the case, ultimately identifying a deficiency in vitamin B12. He notes that, unlike folate deficiency, vitamin B12 deficiency can lead to neurological symptoms, such as numbness or difficulty with balance. This distinction is crucial, as it guides both the treatment approach and the urgency of intervention. Recognizing these nuances ensures the patient receives the most appropriate care. Arjun observes the young woman's anxious demeanor, noticeable tremors, and prominent, bulging eyes. These signs point him toward a diagnosis of hyperthyroidism. He envisions the autoimmune process at play, where the immune system mistakenly targets the thyroid gland, causing it to become overactive. This excess thyroid hormone accelerates the body's metabolism, leading to the symptoms he sees before him. Arjun considers how these metabolic changes can affect nearly every organ system, explaining the wide range of symptoms experienced by his patient. A child presenting with a severe cough and rusty-colored sputum often raises suspicion for Streptococcus pneumonia infection. This bacterium is known for its ability to evade the immune system through a protective capsule, making it particularly challenging for the body to clear. Arjun is familiar with how the immune system responds, recognizing the importance of antibodies and phagocytic cells in combating such infections. Understanding these microbial defense strategies is crucial for effective diagnosis and treatment. A patient taking blood pressure medication begins to experience a persistent dry cough. Arjun recognizes that this side effect is commonly associated with ACE inhibitors, which can cause a buildup of bradykinin in the body. This accumulation leads to irritation of the airways, resulting in the characteristic cough. To address the issue, Arjun considers switching the patient to a different class of antihypertensive medication that does not have this side effect. Arjun encounters a patient who appears confused and dehydrated with a distinct fruity odor on their breath. These clues lead him to consider diabetic ketoacidosis, a serious complication of diabetes. In this condition, a lack of insulin causes the body to break down fat for energy, resulting in the production of ketones. The accumulation of ketones makes the blood acidic, and the body tries to compensate by breathing rapidly to expel excess carbon dioxide. Recognizing these signs is crucial for prompt diagnosis and treatment. Arjun observes that the patient's eyelid weakness becomes more pronounced with repeated use, a classic sign pointing toward myasthenia gravis. This pattern of muscle fatigue helps him differentiate it from other neuromuscular disorders, which may present with persistent or fluctuating weakness, but lack the clear association with activity. By carefully analyzing the progression and triggers of the symptoms, Arjun is able to narrow down the diagnosis. Recognizing these subtle distinctions is crucial in identifying myasthenia gravis and guiding appropriate treatment. Arjun identifies the early stages of septic shock by observing key symptoms such as fever, low blood pressure, and unusually warm skin. These signs indicate that the body is mounting an initial response to a severe infection. At this point, blood vessels dilate, leading to a drop in blood pressure while the skin remains warm due to increased circulation. Recognizing these early indicators is crucial, as septic shock can progress rapidly if not addressed promptly. Understanding the evolving nature of the disease helps guide timely and effective intervention. Nephrotic syndrome is characterized by a combination of edema, proteinuria, and elevated cholesterol levels. The underlying cause begins with damage to the glomeruli, which are the kidney's filtering units. This injury allows large amounts of protein to leak into the urine, resulting in proteinuria and a drop in blood protein levels. As the body tries to compensate for the loss, the liver increases production of proteins, including lipids, leading to high cholesterol. The resulting fluid imbalance manifests as swelling or edema, completing the clinical picture of nephrotic syndrome. Arjun comes to understand that each medical question is more than just a collection of isolated facts. Instead, it represents a story shaped by cause and effect. By following the sequence of events, he can anticipate outcomes and underlying mechanisms. This approach enables him to predict answers, reducing the need for rote memorization. Ultimately, recognizing these patterns transforms his way of learning and problem-solving. He considers how even the most complex medical cases, such as electrolyte imbalances, hormonal disorders, and infections, can be unraveled by applying fundamental physiological principles. By understanding how the body's feedback mechanisms operate, seemingly confusing symptoms begin to make sense. This approach allows for a systematic analysis, revealing the underlying causes behind each condition. Ultimately, it highlights the importance of a strong foundation in physiology when tackling challenging clinical scenarios. Arjun ultimately conquers his anxiety about the exam, realizing that success on the USMLE is not just about memorizing isolated facts. Instead, the test challenges candidates to interpret symptoms and uncover the underlying narrative of each patient case. This new perspective helps Arjun approach his studies with greater confidence and purpose. He understands that clinical reasoning and the ability to connect details are at the heart of what the exam truly measures.
Arjun's mental hospital stands as a hub of intricate clinical challenges, where each patient presents with unique and often overlapping symptoms. Within these walls, the staff navigates a web of cases that rarely fit textbook definitions, reflecting the nuanced realities of mental health care. The environment demands careful observation, critical thinking, and adaptability from every clinician. Here, the complexity of human behavior and mental illness becomes evident, offering a glimpse into the demanding world of real-life clinical reasoning. A young man arrives showing clear signs of hypoxia, yet his oxygen saturation levels appear completely normal. This puzzling contradiction prompts further investigation, ultimately revealing carbon monoxide poisoning as the underlying cause. Carbon monoxide binds to hemoglobin more readily than oxygen, preventing the body from using the oxygen that is present. This case highlights an important lesson. Normal test results can sometimes mask serious conditions. Clinicians must always consider the broader clinical picture rather than relying solely on numbers. A patient presenting with severe abdominal pain raises immediate concern for pancreatitis, a condition marked by inflammation of the pancreas. Common causes include gallstones, which can block the pancreatic duct, and excessive alcohol consumption, both of which disrupt normal pancreatic function. Understanding these underlying factors is crucial for accurate diagnosis and effective management. Recognizing how the disease progresses helps guide treatment decisions and can significantly impact patient outcomes. A woman experiencing fatigue, sensitivity to cold, and noticeably slowed movements demonstrates classic signs of hypothyroidism. This condition occurs when the body produces insufficient thyroid hormones, affecting metabolism and overall energy levels. To accurately diagnose the underlying cause, it is important to differentiate between primary and central hypothyroidism. Measuring thyroid-stimulating hormone, or TSH, levels helps make this distinction. Elevated TSH suggests a problem with the thyroid gland itself, while low or normal TSH points to an issue with the pituitary or hypothalamus. A young athlete's unexpected collapse draws attention to hypertrophic cardiomyopathy, a condition where the heart muscle becomes abnormally thick. Despite appearing strong and healthy, the heart's excessive muscle growth can actually hinder its ability to pump blood effectively. This paradox means that even those in peak physical condition may be at risk. The condition often goes undetected until a critical event occurs, underscoring the importance of awareness and early diagnosis. Hematuria, hypertension, and swelling are classic signs that point toward nephritic syndrome, a condition affecting the kidneys. One common cause is post-streptococcal glomerulonephritis, which often develops after a streptococcal infection, such as strep throat. In this disease, the immune system mistakenly targets the kidney's glomeruli, leading to inflammation and impaired function. The resulting damage causes blood to appear in the urine, raises blood pressure, and leads to fluid retention. Understanding the immune response is crucial for recognizing how these symptoms develop and for guiding effective treatment strategies. A child presenting with a descending rash and distinctive Koplik spots has been diagnosed with measles. This case highlights the significance of understanding the characteristic progression and appearance of viral exanthems. Recognizing these patterns enables timely identification and management of infectious diseases. Measles, in particular, follows a predictable course, beginning with early symptoms and followed by the spread of its rash. Awareness of these clinical features is crucial for accurate diagnosis and prevention of complications. A man experiences joint stiffness in the morning, which gradually improves as he becomes more active throughout the day. This pattern is characteristic of rheumatoid arthritis, a condition where inflammation causes prolonged stiffness, especially after periods of rest. In contrast, osteoarthritis typically presents with stiffness that worsens with activity and improves with rest. The timing and duration of joint symptoms play a crucial role in distinguishing between these two conditions. Recognizing these differences aids clinicians in making an accurate diagnosis and guiding appropriate treatment. A patient presenting with confusion and seizures as a result of low sodium levels highlights the complex interplay within the body's systems. In this scenario, the underlying cause may be SIADH, or syndrome of inappropriate antidiuretic hormone secretion. This condition leads to excessive water retention, diluting sodium in the bloodstream and disrupting normal brain function. Such cases demonstrate how a single physiological imbalance can set off a chain reaction, ultimately affecting multiple organs and processes. Diabetes is a prime example of how a single disease can impact multiple organ systems. Patients often experience complications that affect the kidneys, nerves, and blood vessels simultaneously. These interconnected issues can lead to a complex clinical presentation, making management challenging. Understanding this integration is crucial for effective treatment and for anticipating potential complications. It highlights the importance of a comprehensive approach to patient care. Elevated calcium levels in a patient can be a key indicator of hyperparathyroidism, a condition where the parathyroid glands produce too much hormone. This excess hormone disrupts the body's calcium balance, leading to a range of symptoms. The classic pattern is often remembered as stones, bones, groans, and psychiatric overtones. Patients may experience kidney stones, bone pain or fragility, abdominal discomfort, and changes in mood or cognition. Recognizing this constellation of symptoms is crucial for timely diagnosis and management. Arjun's approach to problem solving has undergone a significant transformation. Initially, he relied on a methodical, step-by-step analysis to understand complex issues. Over time, his thinking has become more intuitive, allowing him to recognize patterns instantly. Now, when he encounters symptoms, his mind rapidly connects them to intricate physiological processes, forming a complete picture almost immediately. This evolution reflects a deepening expertise, where experience enables swift and accurate insights. In summary, the true challenge lies beyond simply recalling facts. It involves piecing together intricate clinical scenarios from limited information, mirroring the integrated approach found in NBME-style assessments. This process demands advanced reasoning, as it requires synthesizing knowledge across multiple systems. Ultimately, success depends on the ability to connect subtle clues and form a comprehensive understanding of complex diseases. Throughout this process, several key skills are developed. Multi-system thinking enables a broader perspective, allowing for the integration of information from various physiological systems. Understanding cause and effect chains helps in tracing how one clinical event can lead to another, revealing underlying mechanisms. Recognizing patterns within clinical complexity is crucial for identifying trends and making informed decisions, even when faced with ambiguous or overlapping symptoms.
As Arjun begins his night shift, the hospital is quiet but brimming with possibilities.
In these hours, clinical reasoning becomes his guiding tool.
The night ahead promises challenges and opportunity. Oxygen sat is dropping. I need to check the mask. Increasing the flow rate now. Come on, respond to me.
Nurse! I need you in here now!
SpO2 is dropping fast. Vital stabilizing. Monitor closely.
This patient's persistent fatigue, skin darkening, low blood pressure. Lab tests confirm low cortisol and aldosterone caused by adrenal insufficiency is key. Early tender treatment, it can lead to serious outcomes. The adrenal glands, located here, produce vital hormones like cortisol and aldosterone. But in Addison's disease, these hormones are deficient. Untreated, it leads to a life-threatening adrenal crisis. The adrenal glands produce cortisol and aldosterone. If they fail, it leads to Addison's disease. Early diagnosis is critical to prevent, but timely testing can save lives. The confusion and eye movements suggest Wernicke encephalopathy. We need to treat. I can't walk straight. It's a thiamine deficiency. We must give thiamine before any glucose. This is crucial. Doctor, is this going to work? Yes, this thiamine drip is exactly what you need. You'll start to feel better very soon. Okay, thank you. IV is for a vitamin deficiency. It's affecting your brain and coordination.
My coordination? I don't understand.
It's temporary. This will help you feel better soon.
He's down. No trauma. The thickened heart muscle disrupts signals, risking deadly arrhythmias. Spotting this early can save a life. Pulse is weak. Stay with me. Help! Somebody call emergency services. Come on. 2, 3, 4, 5. Keep going. Call emergency staff now. Come on. Stay with me. Somebody help. Call an ambulance. Don't give up.
Your muscle strength improves with use.
How is it different from other muscle diseases?
It's a presynaptic defect. The release of acetylcholine is impaired. This is the key difference. Lambert-Eaton syndrome is often linked to an underlying cancer, most commonly small cell lung cancer. So we'll need tests to find the root cause while starting treatment to ease your symptoms. I understand your concern. To be thorough, the next step is an MRI scan. It's painless and will give us a clearer picture. This cough is so painful. This coloration corresponds to lung inflammation, a hallmark of Streptococcus pneumoniae. The bacteria's capsule hinders immune response, making prompt diagnosis critical. Persistent vomiting depletes stomach acid, leading to metabolic alkalosis, where the body's pH rises. The kidneys causes hypokalemia, an electrolyte imbalance affecting cellular function. Nephrotic syndrome is characterized by swelling, foamy urine, and lipid disturbances. These symptoms arise from significant protein loss through the kidney urine, is a direct result of excess protein being excreted. An ACE inhibitor can cause a persistent dry cough by preventing bradykinin breakdown, leading to airway irritation. This mechanism highlights how drugs affect pathways, aiding clinicians in managing side effects. Wait, that cough is from my blood pressure pills? This cough is driving me crazy. It's been weeks since I started this blood pressure medicine. I think it's a side effect. Can we switch to something else? Metabolic acidosis is characterized by a decrease in blood pH due to an accumulation of acids or a loss of bicarbonate. In response, the body increases the rate and depth of breathing to expel carbon dioxide and reduce acidity. The red line extends, showing restaurocompensation. Bicarbonate and PaCO2 remain low. As it bicarbonate, the pH rises from 6.5 towards 7.0. Respiratory compensation pH. Lab findings show low bicarbonate and low PaCO2. Respiratory compensation through increased ventilation lowers PaCO2. This partially corrects the pH toward normal. When someone develops bloody diarrhea after consuming undercooked meat, it often indicates a toxin-mediated bacterial infection. In these cases, the bacteria produce toxins that degrade the intestinal lining.
Doctor, my head. The pain is unbearable. It came on so
I
fast.
understand. We're running tests. It could be a subarachnoid range.
A what? Is it serious?
It's bleeding around the brain.
We need to act fast. I know it hurts. I'm right here.
It hurts so much. Breathe. We've got this. Thank you, doctor. Rest now.
We need to do an imaging test immediately. It will confirm if you have a subarachnoid hemorrhage.
Yes.
It's serious, but this scan is crucial. We need to move quickly.
In some cases, patients experience hypoxia even when oxygen levels appear normal. This occurs in carbon monoxide poisoning, where CO binds to hemoglobin more effectively than oxygen. Prompt recognition and treatment are essential.
My muscle weakness gets worse as the day goes on. It started with my eyelids drooping. This fluctuate mark of my disorders.
My state gravis grosses the worsened with activity and my terrified diagnosis. This is a serious condition. We need to act now. Your symptoms are concerning. Let's run some tests. It could be a neurological issue. We must be thorough. I'll explain at every time. Trust me, we're in this together. Let me tell you about a game changer for myasthenia gravis. A simple ice pack test can dramatically improve muscle strength within minutes. This rapid effect is a key diagnostic tool. Doctor, my blood pressure is still high. Let's run some tests to investigate.
The aldosterone is elevated at 25. This explains the high BP and low potassium.
As I look back, I realize every patient is more than a list of symptoms. Each case is a unique story of the body faltering. True expertise means finding the crucial clues.
Of course, it's right there. Right, let's apply this.
As the first light of dawn filters through the hospital windows, a heavy silence settles over the halls. The once constant hum of activity has faded, leaving only the distant echoes of a sleepless night. Arjun sits alone, his thoughts weighed down by the uncertainty that lies ahead. The quietness of the morning hints at the significance of the moment, marking the beginning of a pivotal chapter in his journey. Arjun, weary from the night's relentless pace, allows himself a brief moment of relief, convinced that the worst is behind him. The emergency room has quieted, and the tension in the air begins to fade. Suddenly, another patient arrives, this time without the usual commotion or sense of urgency. The arrival is almost understated, catching Arjun off guard. He quickly realizes that his shift is not yet over, and a new challenge may be unfolding before him. The arrival of a new patient brings uncertainty. Fatigue, a mild fever, and slight confusion are accompanied by abnormal laboratory results. Yet none of these signs point clearly to a familiar diagnosis. The lack of definitive clues leaves Arjun questioning his own clinical judgment. As he reviews the case, the ambiguity challenges his confidence, forcing him to reconsider the possibilities and search for answers beyond the obvious. Arjun looks back on his journey, remembering a time when uncertainty left him feeling immobilized and unsure of his next steps. The challenges he encountered tonight have transformed his outlook, allowing him to approach the unknown with greater confidence. He realizes that growth often comes from moments of discomfort and doubt. With this newfound perspective, Arjun feels prepared to embrace whatever lies ahead, trusting in his ability to adapt and learn. Rather than getting lost in the complexity of the situation, Arjun zeroes in on a single telling detail: the patient's low sodium level. This finding, though easy to overlook, becomes the key to understanding what's really happening. By shifting his attention to this abnormality, Arjun is able to reconsider the case from a new perspective. The low sodium serves as a crucial clue, guiding him toward a more accurate diagnosis. Arjun carefully reviews the patient's symptoms, noting the confusion, persistent fatigue, and unusual lab results. He begins to piece together the clues, recognizing a pattern that points toward SIADH, or syndrome of inappropriate antidiuretic hormone secretion. The diagnosis becomes clear as he realizes that the most subtle sign held the key to understanding the patient's condition. By connecting these details, Arjun uncovers the underlying cause that had been quietly affecting the patient all along. As the patient's condition improves, Arjun takes a moment to consider the events of the night. He realizes that every case, whether it involved chest pain or complex endocrine emergencies, carried its own unique lesson. These situations demanded not only medical expertise, but also attentive listening and thoughtful interpretation. Through each encounter, Arjun understands the importance of patience and observation in delivering effective care. The experiences reinforce his commitment to learning from every patient and every challenge. Arjun realizes that the practice of medicine goes far beyond simply recalling information. Instead, it requires a deep awareness of the subtle signs and signals that the body presents. Even in moments of uncertainty or complexity, he learns to look beyond the obvious and trust his ability to interpret these nuanced clues. This understanding shapes his approach, guiding him to see each patient as a unique story waiting to be understood. With the crisis behind him, Arjun feels a deep sense of fulfillment. It's not the satisfaction of simply finding the correct answer, but the reassurance that comes from trusting his instincts. He realizes the importance of truly seeing the patient as a person, not just a set of symptoms. This experience leaves him with a renewed confidence in his ability to listen, observe, and respond with empathy. As the morning light streams through the hospital corridors, Arjun steps outside, carrying a newfound confidence. The trials he faced overnight have reshaped his outlook, instilling a sense of resilience and determination. With each step, the anxiety about his upcoming exam fades, replaced by an assurance that he can handle whatever comes next. The experience has not only tested his skills, but also strengthened his resolve. The video ends with a thought-provoking message, reminding us that true excellence in medicine is not defined by the breadth of knowledge alone. Instead, it is the ability to recognize and focus on what truly matters that sets the best doctors apart. Compassion, understanding, and insight play a crucial role in patient care. Ultimately, it is this deeper awareness that makes a lasting difference in the lives of those they serve.